Aspirational goals, whether they are slogans and campaigns such as 20 by 20, 3 by 5, every woman, every child, or FP 2020, are incredible drivers of change. But we know in order to be able to deliver on the goals of those campaigns, we need the products to be manufactured, we need the products to be purchased, we need the products to get to the countries and places where the campaigns can really hit the ground and deliver results. But how can we anticipate the volume of products that an unprecedented number of people will need if we want to achieve our goals? And how can we determine how much is currently spent on those products and how much additional funding will be needed to deliver those products, in the case of FP 2020, by 2020? As seemingly straightforward as these questions may be, the reality is that they don't lend themselves to easy answers. The global family planning community has developed a rich array of methodologies and tools and data sources, but unfortunately they can lead to a proliferation of a lot of conflicting messages and really confusion and sometimes even contradictory messages. And so what we've done, and another thing that's also important, is the kind of information groups need, donors need, for example, may be very different from the kind of information that manufacturers need. So in taking up the challenge of projecting and quantifying the growing demand for contraceptive supplies, we turned to the convening power of the Reproductive Health Supplies Coalition to think strategically about the value these methodologies offer and the ways they can be sequenced and juxtaposed to provide greater insights. Following the leadership of an advisory committee made up of a number of people in this room, Wynne Brown, Jackie Derrick, Ian Askew, John Stover, John Bongartz, you really engaged in a series of wide consultations, reaching out to a total of about 43 donors, manufacturers, advocates, and technical experts representing about 25 different agencies. And it's really on the basis of the input that you provided that we identified the scope of this effort. We identified the 135 low and middle income countries as defined by the World Bank as our broad scope, broad catchment area, and within that, special attention to the subset of the 69 FP 2020 countries. You also, as a result of the feedback that we received, inspired our decision to posit two different scenarios for growth. A gap, the notion of a gap, obviously presupposes two endpoints, beginning and end. And where we go with a gap is really a function of where we see ourselves moving. So we've set out two scenarios. Scenario A, which really assumes countries will continue on the historical track that they've been moving over the last decade, and the scenario B, which envisions the achievement of FP 2020's flagship goal, namely 120 million more users of contraception in 2020 than was the case in 2012. And it also, if that is achieved, we also assume that it will have a ripple effect beyond the 69 countries in seeing increases in prevalence there. So for each scenario, we looked at the number of users of each contraceptive method, the volume of supplies that each would consume, the cost of those supplies, and then we estimated the total amount currently spent on supplies. And for each scenario, we then show the gap between the amount currently being spent and the amount needed in the future. Over the course of this session, which is a very brief session, we only have 45 minutes this morning, we have Michelle Weinberger and Emily Sonneveldt from Avenir Health who will discuss this in their presentations. But that's not all, and I think this is an important thing as well to keep in mind, and really one of the, I think, sort of really significant aspects that came from pooling together from across the Reproductive Health Supplies Coalition the input into this analysis. And that is that the amount of supplies that are required by women is really only one of the factors a government will consider when developing its procurement plans. Another consideration is the quantity required to fill supply pipelines, from central warehouses to individual service delivery points. This is a critical point to keep in mind, and we'll discuss this a little bit later on. And helping us get through that will be Mindy Scibilia from CHAI, who will explain an analysis produced by a team of experts by JSI and CHAI that draws from quantification exercises and supply plans from 20 countries, including the 11 countries participating in the Global Financing Facility. Now, as I noted earlier on in the discussion, this analysis really benefits from what we talk about when we talk about the power of partnership. But partnership often hinges on having someone in the middle, someone who can balance the different perspectives, achieve a degree of consensus, and come out with an outcome that everyone can agree on. And there's one person not on this panel, but who's played an incredibly important role in bringing all of this information together, and also in authoring the report that you all have on your chairs, and that's Nina Miller. I'm not sure where Nina Miller is, but, right here. So thank you very much, Nina. If we can begin, Michelle.
So before we look to the future in these two scenarios that John just spoke about, we thought it was helpful to ground ourselves in looking where we are now. And so our estimates looking across this full set of 135 low and middle income countries is that we have just over 450 million women using modern contraception across this set of countries. One thing I think that's important to note is this includes all women, both married and unmarried, and women who are accessing their services from both the public and private sector, so encompassing a full view of the spectrum of contraceptive use. We also know that about 2/3 of these women are living in the set of FP 2020 focus countries. And as Beth told us yesterday, we know that there's great success in achieving a new milestone of unprecedented use across those countries and across this wider scope. So if we look to what methods these women are using, we see that overall that users of sterilization make up the largest single proportion. This is mostly driven by India. And I think it's helpful to say as we look at these results that what we're looking at is sort of adding together individual and varied patterns that we see across 135 countries. So while today we're just going to look at some of the headline results, we hope in the future there'll be more opportunities to dig into this data and start to see those different patterns that we see across different countries and different regions. I think it's also useful to note here that we see quite a variation of method mix as well in terms of the mix of short-term methods, and we're starting to see a small but growing proportion of women relying on implants. So before we look at the numbers out to 2020, I wanted to say a little bit about how we got there. So yesterday there was a lot of talk about data. There's a lot of talk about the limitations of the data that we have, a lot of talk about how we can make better use of the data that we have. And so one thing I wanted to point out is that this analysis and this methodology really drew on a vast array of data sources. And I think it shows the power of what can be done through a coalition like this when we bring together different approaches, different viewpoints, as well as different types of data. So I'm just going to quickly walk you through the 4 main steps that we took and highlight some of the information that fed into each of these. So first, we needed to estimate how many women will be using contraception in each of the countries. And we did this by using statistical models that let us pull together all the data that we have. So whether that be from surveys or in 13 countries using HMIS data coming from service statistics to really inform us not only about where countries are now, but where they're likely to be in the future if they carry on their current trajectory. And then we wanted to have a better understanding of what methods these women will rely on. And we know that method preference isn't static, and we're already seeing shifts starting to happen. So our analysis built in changes at a country level and method mix based on recent patterns that we're seeing. So for example, if we look to survey data, we see increases in implants across East Africa and West Africa. So these patterns are changing as we go forward to 2020 and affecting the results that we're seeing. Next, we need to understand the volume of commodities that these women will need in order to be users, in order to achieve this level of use. And as John said in his opening, this is important to understand in terms of thinking about, will we be ready to meet this need? Will these commodities exist? Do we have the manufacturing power to get them? Do we have the money needed to purchase them? Do we have the systems needed to distribute them out? And so having a better sense of what that need looks like will help us start to unpick those other questions. So for this analysis, we looked at how many contraceptives would be needed by each user by method. So for short-term methods, we're accounting for how many individual commodities are needed for a woman to be covered and protected for an entire year. And for long-acting and permanent methods, we accounted for what portion of women will need a method in any given year, also accounting for the fact that some women will continue to use a method they had previously received. So looking at sort of what the need is in any given year for new consumption or services to be provided. And I'd like to give a special thank you to Jackie and her work at Guttmacher for adding it up, for providing us some invaluable information that fed into this that let us pick up country variations within this. So we know that in different countries, different mixes of products are being used, and we're able to use that information to make sure that this analysis picked up on those nuances and differences. And that information also helped us pick up on nuances and differences in cost, recognizing that the brand of commodity and the type of commodity being purchased in different countries varies, and therefore the costs that consumption will have varies country to country. So our analysis also accounts for these country-level variations. And Emily will follow after me and talk a bit more about what that cost means as we look forward to 2020. So John mentioned that we have two paths following out to 2020. So under scenario A, we look at what would happen if current trajectories continue. So if countries were to continue on the pattern that we already see them on, so we see some countries that are accelerating, so what happens for those countries as that acceleration continues, and we see other countries that are maybe not seeing large acceleration, some changes from their past trends, so what would happen if those trends continue? And across the 135 countries, we estimate that by 2020, the number of women using modern methods of contraception would rise to 490 million. And then we also wanted to posit a second scenario, a scenario where we see our collective efforts come together to rally our community and help us bend that curve to accelerate towards achieving the FP 2020 goal, and as John mentioned, to see that ripple effect, so that if those big changes happen, we would expect that in the 66 countries that aren't part of the FP 2020 initiative would see some increases as a result of all that focused effort. So under that scenario, you can see that the number of users climbs to nearly 550 million. But we know, as these changes happen, that not all methods gain equally. So what you can see here are results for the 135 low and middle income countries. So we see the growth in users that's happening from 2016 to 2020 under each scenario, and we see how that distributes by method. So one thing I wanted to point out is we see some declines in scenario A. So we see a little bit of a drop in pills and IUDs, mirroring some of the patterns that we're seeing out of survey data of these methods slipping a bit, potentially as methods like implants and injections are rising and becoming more prevalent within the method mix. And we also see that many methods stay relatively static over time and some larger gains in other methods. And again, these patterns are the aggregate of all these individual changes that are happening across the 135 countries. So a lot is hidden here. The changes aren't huge because when you add together so many different individual patterns up, we kind of smooth over some of those changes. So as we start to dig into this data more and look at variations by region and variations by other subsets, some of these changes are more dramatic in certain parts of the world. So for the 69 countries, we have a similar graph, and we see that generally the patterns are quite similar. Again, because the subset of FP 2020 countries makes up about 2/3 of the total of the 135 we're looking at, the patterns and changes that happen among those countries largely influence what we're seeing in that larger picture. So once we have our users, we're able to move on to look at consumption. So what this slide shows us is the number of supplies and commodities that we would expect to be needed in each year, starting in 2016 and up to 2020, looking at the change that happens over that time. So one thing I wanted to note is we looked both at the contraceptive commodities themselves as well as the associated supplies needed, which is why here sterilization has a number to it. So this would be the kits needed in order to provide those services. And then for other methods, it would be the contraceptive itself and any additional supplies that would be needed in order to deliver that contraceptive. So one thing I wanted to point out is in terms of the relative change, we see that implants, so picking up on the recent trends that we're seeing in the data, have the largest percentage growth. So a 50% increase over this very short period in the number of implant commodities that would be consumed, so the number of insertions that would happen across these countries over this time period. So we estimate that by 2020 that there will be 2 million more implants used by women, inserted or provided in 2020 than there are today. So quite a large change for that method, picking up on many of the initiatives that have been happening across the 69 countries to really look at increasing access to a wider array of both short-term and long-acting methods. And we also see that the popularity of injectables largely we expect to stay, and also see growth in this method, again mirroring changes that we're seeing when we look across these countries. So one thing to note is just because of time, we don't have too much time here today. I'm just showing you results for one of our 4 sets of results. So this is looking at the 69 countries under scenario A. This data is also available for scenario B, for the same set of countries, as well as for the wider set of 135. So as you can imagine, it's quite a rich set of data that sits behind this work. So the brief that you have now is just sort of top-line summary, but there's a lot more information that will be coming out from this over the coming weeks and months that allow us to delve into this more, and as a community to really be able to start to look at how we can use this information to inform decisions, discussions, advocacy messages, and all of those types of things. So before I hand it over to Emily to talk about spending and cost, I just wanted to talk about how we pivoted from looking at users and consumption to then getting to costs. So once we have our volumes of consumption, we're able to monetize those. We're able to use these unit prices provided by Guttmacher that feed into their adding it up estimates in order to say, what would that cost? What would it cost to provide all of those contraceptives to women in each given year? Again, accounting for these country variations in the cost of methods. And what we found was that we think today, so in 2016, that the total cost of consumption across the FP 2020 69 focus countries would be about $895 million. So this is the cost needed to provide contraceptives to users. This doesn't take account of some of the other costs, like John mentioned, around procurement and supply. This also doesn't account for freight. So this is really just the bottom of that base, the cost of the commodities that would be consumed by women in 2016 to get us to the total use that we see today. And one thing I think is useful to look at is we all know that different methods have different costs, and that different methods need a different amount of supply for a woman to be protected for a full year. And so as we look at this graph, when we look at the mix of method use across the 69 countries, we see that it looks quite different to the distribution of costs. So the second bar shows us the relative contribution of each method to this total, to this 895 million, versus the relative contribution of each method to the total number of users. So I think a striking one to point out here is that while injections only make up about 20% of the users, they more than double that representation in terms of cost, so making up 44% of the cost burden. And so having this information helps us better understand how shifts in method mix and change in preferences might impact cost in the future, and better understand how we can be prepared not only to have the commodities, but also the funds available to support different trends and different preferences that we might see going forward. Now I'm going to pass over to Emily, who's going to talk to you guys about the future costs.
Okay, so I have the relatively easy job of taking the last step in the analysis that Michelle just described and simply applying some estimates of how much money is going to be needed to reach this unprecedented number of users. So we're going to look at how much is currently being spent and then how much additional spending that we anticipate needing under the two different scenarios that were introduced by John in the beginning and then detailed by Michelle during the last part of the presentation. So when we say current spending, for the purposes of this analysis, we're speaking about 2014. We all know there's a lag time in having access to data. So the most recent year that we're able to have a full accounting of the information that we need to estimate that number was in 2014. So we know now that in 2014, about $1.2 billion were spent on supplies and commodities, and that amount of money was coming from three main sources. So we have about 17% or so of that was contributed by governments, which is a little bit more than 200 million. We have about 25% of it coming from donors, which is a little bit more than 300 million. And then we have about 58% of that coming from the private sector, which is just a little bit less than 700. And the examples that I just read are from the left side of the graph, coming from the 135 low and middle income countries. Right? So since we're looking at the total expense, to meet the needs of all of the users that we're using in 2014, we're able to allocate up those expenses by who's contributing and what source is providing the resources. If we do a breakdown just for the 69 FP 2020 countries, we can see across those countries, the expenditures or the expenses in 2014 were 821 million, the smaller graph there on the right-hand side, and that we have the same three sources of funding, although there's some slight variation in how much they're contributing between the two scenarios. So you can see in the version with the 69 FP 2020 countries that the governments are contributing about 15%, which is slightly less than what we see for the larger catch of countries, which is really not a surprise considering that FP 2020 is focusing on the lower income countries, so we would expect a smaller contribution from governments. And also, as expected, we see a slightly larger contribution from donors within these countries who are contributing about 30% of that 821, or just under 250 million. And then the private sector is also here playing quite a large role, looking at about 55% in terms of cost. And just to give a little bit more information, for government, this includes just basically governments who are paying directly to purchase contraceptive commodities and supplies. Right, so this is the actual government line budgets that are spent on procuring commodities. For donors, this could include donors that do direct purchase of contraceptions. It could be contributions to basket funding. It could be contributions from social marketing programs, from other NGOs, or from money from World Bank loans that are used to purchase contraceptives. So the donor has a little bit of a variety that's underneath that number. And then for the private sector, the vast majority of this is actually out-of-pocket expenses from users. Although there is some other funding in there related to corporations or company contributions to health insurance schemes. So there's a little bit more of a mix in there. So there's a lot of sources that went into putting together a slide like this, a lot of information that was pulled from partners and other people within the community. They're listed across the bottom, and they're important because they all enable us to look at a different aspect of producing this kind of information. So they're coming from NEEDI, which is funded by UNFPA Donor Support Database, various contraceptive security indicators, and then model estimates related to the out-of-pocket expenditures that represent the private sector. And then, of course, the cost of the commodities and supplies themselves, which, as Michelle mentioned, were provided by Guttmacher. So this is where we started, but I would imagine that most people are actually a little bit more interested in what we anticipate the future cost to be and the future need to be, and how much money is going to need to be available to be able to meet the needs of a growing base of contraceptive users. So if we start with the scenario looking at the larger group of countries, so if we start with the 135 low and middle income countries, we start with what we know about what was spent in 2014, and then we're able to project forward using the two scenarios A and B that were described by Michelle. So if we look at A, and then just as a reminder, this is the scenario where the current trends continue for the next 4 years. We can see that the total amount that's needed to for commodities for that increased number of users goes from about 1.2 billion to about 1.5 billion. And to do this estimate, we kept the contribution from each of those three sources constant. So we know that in 2014, governments contributed 17% of total. So for our projected amount, we've said that governments will still contribute 17%, but of course, that represents a larger number, right? Because we've increased the entire pie. So our pie has grown. So governments would need to go from a little over 200 million in 2014 to just under 260 million in 2020 in order for them to keep up with their share of the contribution. So an easier way to look at that is just to look at what's the difference. How much more would each of those three sources need to provide in 2020 compared to 2014? So under scenario A, donors would need to give about 82 million more, governments about 54, and the private sector about 186. And it's important to think of this as a whole pie. So if, for example, the donors were actually able to contribute 50 million more instead of the 82, that 32 million would either have to be absorbed by governments or private sector, or it would become a funding shortfall, right? So if the pie isn't expanding equally amongst that same distribution that we see in 2014, that change has to be absorbed by the other two segments, or is simply something that's not available, and it's a funding shortfall that we don't have, meaning that the commodities aren't available in countries. If we look at the same number for the scenario B, which grows our pie even bigger, so we start with with a larger pie. In this case, we go from 1.2 billion in 2014 to about 1.74 in 2020. And again, we're keeping the relative contributions of each of those three sectors constant as the numbers themselves are actually rising. So therefore, we get, of course, larger shortfalls or larger increases that we need to see if we want to avoid a shortfall under this scenario. So as a reminder, scenario B is meeting the FP 2020 goals plus a ripple effect in the non-FP 2020 countries to show an increase in contraceptive users. So using this scenario, donors would need to increase by about 137 million, governments by about 91, and then the private sector by a little bit more than 312 million. So substantial. This is a big increase. But 120 million additional users is a lot of women. It's a lot of users, and there's a cost associated with that. So this is our ability to be able to start quantifying that in a way that we can use it to better understand what the resources need to be available in the future, and how we anticipate that being distributed between the main sources of funding and who is actually providing those contraceptives. So we have the same scenario for the FP 2020 69 countries, just to give an idea of what the additional costs are for expansion. So under scenario A, again, we're holding the contribution from each sector, their percentage constant. Just for the current trends continuing under scenario A, we would need about 70 million more from donors, 36 from governments, and 127 from the private sector under our sort of base scenario. And then the scenario of us actually achieving our goals and actually expanding access and use amongst 120 million additional, you can see the higher numbers in the bottom. So I see that many people are actually reading the report, but I just wanted to point out that there's an actual table in there, and I'm sure some of you have actually gotten to it, so you've already seen it, where you can actually have more time to look at some of these numbers. I know we went through them relatively quickly, but we have a very tight session, and so I didn't want to spend too much time on the numbers themselves when you actually have the ability to look at them in much more detail within the packet that you have. to be able to really understand what our anticipated needs are as we move forward and start having discussions about, as a community, how can we make sure that the products are there and available for the women we are motivating to use them. And I'll pass over to Mindy.
So for our analysis, we took a little bit of a different approach and looked at just the public sector. And the focus of our analysis was on the quantities required for procurement, which includes both anticipated consumption and also the commodities required to ensure that there's adequate levels of stock at each level of the supply chain. So the larger 135 country analysis that we just heard about includes both the public and the private sector and looks at just the anticipated consumption aspect. And so for a product to actually reach the end user at a service delivery point, there has to be enough stock at each level of the supply chain in order for the user to actually receive that product. So when countries are planning their orders, putting together their procurement plans, they're looking at both what's needed to fill the supply chain and to meet that anticipated consumption. And so, how do countries come up with the magic question of how many products to order? And typically, on an annual basis, country stakeholders will come together in a forecasting technical working group or commodity security group, and usually this includes members from the Ministry of Health, NGOs, procurement agents, donors. They'll come together in a 5-day workshop, and during the quantification process, they'll look at forecasted consumption, stock on hand levels, supplier lead times, inventory control parameters, orders that are already in the process, among other factors as well. And so when these are countries' own estimates of what they need based on agreed upon growth scenarios and scale-up plans for family planning services in the country. And so generally, these are based on realistic scenarios rather than aspirational targets, and they align with that country and donors' funding cycles. And so typically when countries are putting together a supply plan, this will cover 2 to 3 years of planning, even though they're updating these figures on an annual basis. And so the results of the quantification exercise is what governments and donors typically use to determine how many commodities to procure. And so this level of data and this detail is not widely available and did not make sense to use for a broader global analysis. And so we used this level of data for our analysis, which for the first iteration of this includes just 20 countries. And we looked at, we estimated the funding gap related to the costs of products to be procured for 2016 to 2020 for the public sector based on this data. And so how exactly did we come up with the magic figure of how many commodities need to be procured from 2016 to 2020? So we looked at the quantification reports, like I said, and we looked at what the country forecasted their consumption would be. And if they didn't forecast consumption through 2020, we applied a linear trend line and then made some minor adjustments depending on the country. And to come up with the procurement quantities, we looked at the country supply plans. And so in the instance when a country did not supply plan forward all the way to 2020, we used a supply plan model that we developed using the country-specific inputs. So their forecasted consumption, the country-specific min and max levels of the supply chain, stock on hand, to come up with those procurement quantities by country for the 20 countries in which we had data for. We then, in order to get the costs, we took those procurement quantities and then we took the average unit price for UNFPA and USAID product costs, and then we also took the country-specific freight estimates. We then took the procurement costs and compared that figure to the historical spending, which Emily just presented on, but looked at just the public sector spend for those 20 countries. And so that includes the government and donor spending for just those 20 countries to come up with the funding gap. So what did we find out? So for our analysis projects that for the 20 countries in 2016, $210 million is required for procurement of commodities for the public sector across these 20 countries. And this grows to $337 million by the year 2020. And you'll notice a slight dip in 2019. And this is just because of the timing of the shipments. There was a couple of countries, high volume countries, in which there was an orders that fell at the end of 2018 and at the beginning of 2020. And so you'll see a slight dip there due to the nature of how supply planning works. And when you compare these total procurement requirements to the historical funding levels from 2014, you'll notice, the historical spending from 2014 for the public sector for these 20 countries was $166 million. And so if funding were to remain at this level, the funding gap would be $45 million in 2016 and would grow to $171 million by the year 2020. The total gap across all 5 years was $560 million. And so one thing to note about the historical spending here is 97% of the funding was from donors. And so any change in donor spending for procurement for these countries has a big impact on the supply availability in these countries. And so when we think about solutions to funding gaps, we need to think about the challenges both from the donor spending perspective, but also from government spending. And although this analysis just includes 20 countries, these 20 countries represent 63% of institutional procurement from 2011 to 2015 across all 69 countries. And so this is a good representation of likely a much bigger problem of funding gaps for commodities. And we also took a subset of these 20 countries and looked at just the current 11 global financing facility countries to see what the procurement requirements would be for this subset. And we found that 84% of the total procurement requirement was made up by just the GFF countries. And so, in turn, the funding gap is also large for these countries. And so when you compare to historical spend for the GFF countries, the funding gap, if funding levels were to remain stagnant, the funding gap would be $40 million in 2016 and would grow to $155 million in 2020. And so what do these funding gaps mean? These are happening right now. Countries are having to make hard decisions in 2016. They have to, as they're thinking about next year, they're having to order more to make up for the lack of supplies from this year. So this problem gets perpetuated the longer it happens. And supply gaps that result from lack of funding, it has multiple impacts across family planning services, including the ability of the public health system for these countries to carry out planned programs, to do planned expansion, the ability of healthcare workers to retain skills, to use and administer products, the ability of women to choose and access the method of their choice. And taking just one example of DRC, is a country who conducted a quantification exercise. They looked internally for funding and came up short. So what does this mean? There's a couple, Dodo and Irene, who live just outside of Kinshasa. They have 4 kids. Irene was interested in getting an implant. The family was not ready to have another child and was interested in getting an implant. Irene goes to the health facility, waits in line all day for a product, only to hear from the healthcare worker that implants are stocked out. Luckily, Irene had the ability to go back to the health facility a couple months later. When she went back to the health facility, products were still stocked out. And this isn't just implants for this health facility. This was across multiple products. And it wasn't just this facility. It was across a lot of facilities. DRC is facing a funding gap right now. And this means that not only does Irene not get the product of her choice, but this undermines the credibility of the service delivery system. Word spreads, women start to not trust the quality of the services that are being provided, and not to mention the risk of unintended pregnancy and the associated morbidity and mortality. And before I finish, I want to leave us with a challenge today. So we've quantified the funding gap. So what? What are we as the family planning community going to do to bring targeted solutions to address these funding gaps, to eliminate stockouts, and to look at how can we ensure that every woman has access to the method of their choice when they want it? Thank you.
Well, thank you very much to all of the presenters. We've actually come to the end of this session. I know it's a lot of information to provide in a relatively short period of time. But as Emily said, we're in the midst of preparing a much larger report that contains a lot of the information that you have in summary form in this report that was placed on all of your chairs. That will be available soon. That will be online. And we also intend to host a webinar that'll provide an opportunity for those of you who are interested in knowing more, in questions, and also looking at this not just from the perspective of donors, but also from the perspective of manufacturers who see this information as potentially an incentive to be able to invest in commodities, knowing where demand is going to go over the coming 5-year period. So thank you very much. Please feel free to share your feedback with us. And I look forward to hearing from a lot of you when we host our next webinar. Thank you very much.
Thank you very much, John. Thank you to our speakers.